When you get a big cavity filled, do you think that your dentist is removing all of the decay? Do you think that it's necessary to remove all of the cavity out of your tooth in order to fix it? Well, the answer to that question is no. You don't have to. We actually don't remove all of the cavity out of your tooth, especially if the cavity is right on the nerve. If the cavity is right on top of the nerve, and removing that area of decay will, we know, expose the nerve. It has now been shown that we actually don't even need to remove it because our bonding materials and techniques for bonding and adhesion to tooth structure is so effective that we can seal it very well, create a nice peripheral seal around that area, and the bacteria that is trapped in there will naturally just perish.
Okay, so you're seeing this, right? This is a big cavity, isn't it? If you went to the dentist, the traditional dentist, with this situation, you would certainly get a lot of talk about needing a root canal. You know, even if it's vital. Even if it's vital. The thought process is that once we remove all the decay there, that it's going to hit the pulp. And that's where biomimetic dentistry differs. And our understanding of how dental decay spreads through teeth has changed. There's a lot of new studies that are showing how the origins and the issues with dental decay and how it progresses. And we all know that, bacteria and sugar equals acid that breaks down your tooth structure and causes the cavity. So those are the three things: bacteria, sugar, and acid, right? When we look at these cavities, we as biomimetic dentists, we are really able to seal off teeth very, very well. We have high bond strengths in the way we do the dentistry, do the restorations, so much so that we can seal this off so well that if we left decay in there and sealed it, bacteria needs food to multiply and create acids and grow the cavity. If we seal it off, there's no food supply. Bacteria simply dies off. The cavity will be halted. So we find that there is no need to remove all the cavity if removing all the cavity means we're going to expose the pulp.
Because there's no food supply for them anymore. So the bacteria die, and your tooth is allowed to heal the rest of the area. Over time, the dentin will strengthen underneath there again, and your body will fill in and heal that area of dentin, create a little bridge between the affected area and your nerve, and we can preserve your tooth's vitality for many more years, hopefully. That's the goal of biomimetic dentistry. That's what we do. And they get to keep the vitality of their teeth and avoid killing the nerves and creating a cascade of events that are irreversible. once we remove your nerve, it's irreversible, isn't it? We can't grow it back. So it's important to understand that, the way decay behaves in tooth structure has changed so much since dentistry, the practice of dentistry began all of these years ago. We know exactly how decay happens, right? We know exactly how it happens now. And now in modern dentistry, our materials are advanced enough that we can chemically bond the tooth so strongly that the bacteria has no access to sugars or food supply anymore. So it's very exciting. It is very exciting with all of these advanced techniques and materials we have at our disposal to help you to keep your teeth for longer, and keep them alive.